NMCCBT questions and answers. Question number 226. A client with hypothyroidism asks the nurse if she will still need to take thyroid medication during the pregnancy. The nurse's response is based on the knowledge that Option A. There is no need to take thyroid medication because the fetus's thyroid produces a thyroid-stimulating hormone. Option B. Regulation of thyroid medication is more difficult because the thyroid gland increases in size during pregnancy. Option C. It is more difficult to maintain thyroid regulation during pregnancy due to a slowing of metabolism. Option D. Fetal growth is arrested if thyroid medication is continued during pregnancy. The correct answer is option B. Regulation of thyroid medication is more difficult because the thyroid gland increases in size during pregnancy. Question number 227. An infant who weighs 8 pounds at birth would be expected to weigh how many pounds at 1 year? Option A. 14 pounds. Option B. 16 pounds. Option C. 18 pounds. Option D. 24 pounds. The correct answer is option D. 24 pounds. Question number 228. After lumbar laminectomy, which the appropriate method to turn the patient? Option A. Patient holds at the side of the bed, with crossed knees, try to turn by own. Option B. Head is raised and knees bent, patient tries to make movement. Option C. Patient is turned as a unit. The correct answer is option C. Patient is turned as a unit. Question number 229. Patient manifests phlebitis in his IV site. What must a nurse do? Option A. Recite the cannula. Option B. Inform the doctor. Option C. Apply warm compress. Option D. Discontinue infusion. The correct answer is option D. Discontinue infusion. Question number 230. What position should you prepare the patient in pre-op for abdominal paracentesis? Option A. Supine. Option B. Supine with head of bed elevated to 40 to 50 centimeters. Option C. Prone. Option D. Side lying. The correct answer is option B. Supine with head of bed elevated to 40 to 50 centimeters. Question number 231. A patient was recommended to undergo lumbar puncture. As the nurse caring for this patient, what should you not expect as its complications? Option A. Swelling and bruising. Option B. Headache. Option C. Back pain. Option D. Infection. The correct answer is option D. Infection. Question number 232. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of highest priority for this client? Option A. Taking hourly blood pressures with mechanical cuff. Option B. Encouraging fluid intake of at least 200 milliliters per hour. Option C. Position in high fallers with knee gauge raised. Option D. Administering Tylenol as ordered. The correct answer is option B. Encouraging fluid intake of at least 200 milliliters per hour. Question number 233. A client is diagnosed with hepatitis A. Which of the following statements made by client indicates understanding of the disease? Option A. Sexual intimacy and kissing is not allowed. Option B. Does require hospitalization. Option C. Transmitted only through blood transfusions. Option D. Any planned surgery need to be postponed. The correct answer is option A. Sexual intimacy and kissing is not allowed. Question number 234. A 21-year-old male with Hodgkin's lymphoma is a senior at the local university. He is engaged to be married and is to begin a new job upon graduation. Which of the following diagnoses would be a priority for this client? Option A. Sexual dysfunction related to radiation therapy. Option B. Anticipatory grieving related to terminal illness. Option C. Tissue integrity related to prolonged bed rest. Option D. Fatigue related to chemotherapy. The correct answer is option A. Sexual dysfunction related to radiation therapy. Question number 235. The client has surgery for removal of a prolactinoma. Which of the following interventions would be appropriate for this client? Option A. Place the client in Trendelenburg position for postural drainage. Option B. Encourage coughing and deep breathing every 2 hours. Option C. Elevate the head of the bed 30 degrees. Option D. Encourage the Valsalva maneuver for bowel movements. The correct answer is option C. Elevate the head of the bed 30 degrees. Question number 236. Ms. Jane is to have a pelvic exam. Which of the following should the nurse do first? Option A. Have the client remove all her clothes, socks and shoes. Option B. Have the client go to the bathroom and avoid saving a sample. Option C. Place the client in lithotomy position on the exam table. Option D. Assemble all the equipment needed for the examination. The correct answer is option C. Place the client in lithotomy position on the exam table. Question number 237. A client tells the nurse that she plans to use the rhythm method of birth control. The nurse is aware that the success of the rhythm method depends on the option A. Age of the client. Option B. Frequency of intercourse. Option C. Regularity of the menses. Option D. Range of the client's temperature. The correct answer is option C. Regularity of the menses. Question number 238. The client is admitted with left-sided congestive heart failure. In assessing the client for edema, the nurse should check the option A. Feet. Option B. Neck. Option C. Hands. Option D. Sacrum. The correct answer is option B. Neck. Question number 239. A client is admitted to the unit 2 hours after an explosion causes burns to the face. The nurse would be most concerned with the client developing which of the following? Option A. Hypovolemia. Option B. Laryngeal edema. Option C. Hyponatremia. Option D. Hyperkalemia. The correct answer is option B. Laryngeal edema. Question number 240. A client has cancer of the pancreas. The nurse should be most concerned about which nursing diagnosis? Option A. Alteration in nutrition. Option B. Alteration in bowel elimination. Option C. Alteration in skin integrity. Option D. Ineffective individual coping. The correct answer is option A. Alteration in nutrition. Question number 241. A client with a diagnosis of HPV is at risk for which of the following? Option A. Hodgkin's lymphoma. Option B. Cervical cancer. Option C. Multiple myeloma. Option D. Ovarian cancer. The correct answer is option B. Cervical cancer. Question number 242. A client being treated with sodium warfarin, Coumadin, has a pro time of 120 seconds. Which intervention would be most important to include in the nursing care plan? Option A. Assess for signs of abnormal bleeding. Option B. Anticipate an increase in the Coumadin dosage. Option C. Instruct the client regarding the drug therapy. Option D. Increase the frequency of neurological assessments. The correct answer is option A. Assess for signs of abnormal bleeding. Question number 243. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid eating. Option A. Fruits. Option B. Salt. Option C. Pepper. Option D. Ketchup. The correct answer is option C, pepper. Question number 244. Following a heart transplant, a client is started on medication to prevent organ rejection. Which category of medication prevents the formation of antibodies against the new organ? Option A, antivirals. Option B, antibiotics. Option C, immunosuppressants. Option D, analgesics. The correct answer is option C, immunosuppressants. Question number 245. A client tells the nurse that she is allergic to eggs, dogs, rabbits, and chicken feathers. Which order should the nurse question? Option A, TB skin test. Option B, rubella vaccine. Option C, ELISA test. Option D, chest x-ray. The correct answer is option B, rubella vaccine. Question number 246. The client with a pacemaker should be taught to: Option A, report ankle edema. Option B, check his blood pressure daily. Option C, refrain from using a microwave oven. Option D, monitor his pulse rate. The correct answer is option D, monitor his pulse rate. Question number 247. Early ambulation prevents all complications except: Option A, chest infection and lung collapse. Option B, muscle wasting. Option C, thrombosis. Option D, surgical site infection. The correct answer is option D, surgical site infection. Question number 248. The first techniques used to examine the abdomen of a client is: Option A, palpation. Option B, auscultation. Option C, percussion. Option D, inspection. The correct answer is option D, inspection. Question number 249. Which of the following would be an appropriate strategy in reorienting a confused patient to where her room is? Option A, place picture of her family on the bedside stand. Option B, put her name in a large letter on her forehead. Option C, remind the patient where her room is. Option D, let the other residents know where the patient's room is. The correct answer is option C, remind the patient where her room is. Question number 250. When a patient is being monitored in the PACU, how frequently should blood pressure, pulse and respiratory rate be recorded? Option A, every 5 minutes. Option B, every 15 minutes. Option C, once an hour. Option D, continuously. The correct answer is option A, every 5 minutes.